Bipartisan health package. Republicans' plan to lower drug costs. Imagine a future where affordable health care is a luxury of the past. Unfortunately, this is the harsh reality that millions of Americans are facing today. The rising costs of health insurance and prescription medications have become a significant burden for many families. But here's where it gets interesting. Republicans are now working on a bipartisan health package to lower these costs, and it's leaving many Democrats skeptical. The proposed package, led by Senator Bill Cassidy, aims to increase transparency from pharmacy benefit managers and address upcoding practices in Medicare Advantage. However, the question remains, will this package be enough to make a significant difference? And this is the part most people miss. The package is still in its early stages, and many details are yet to be disclosed. Senator Michael D. Crapo, the chairman of the Senate Finance Committee, remains tight-lipped about the package, saying that they're discussing everything that people want to look at as issues. But Democrats are not holding their breath, still feeling earned from the previous reconciliation package that cut billions of dollars from Medicaid and made it more difficult for people to receive healthcare subsidies. As Senator Ron Wyden, the top Democrat on a Senate Finance Committee, put it, they always say they're interested in working in a bipartisan way, and then you open up one of the front pages of your publications to see that Republicans are interested in another reconciliation bill. Nevertheless, there is one area where both parties seem to agree: the need to extend expanded healthcare subsidies, which are set to expire at the end of the year. If Congress doesn't act, millions of Americans will face significant increases in their health insurance costs. Senator Lisa Murkowski, who is part of the small group working to extend these subsidies, warned that our failure to do that could result in some pretty precipitous increases in costs for Americans for their health insurance. But here's the controversy. While some Republicans, like Senator Cassidy, are pushing for an extension, others seem less urgent about addressing the issue. Insurers are already requesting double-digit premium increases for next year, citing the expiration of subsidies and the impact of tariffs on some drugs and medical equipment. The nonpartisan Congressional Budget Office estimated that a permanent extension of the subsidies would cost $335 billion over 10 years. Other potential contenders for the health package include a bill to address upcoding in Medicare Advantage plans and a slate of pharmacy benefit manager (PBM) bills. The PBM bills have already advanced in the Senate Finance Committee, with members of both parties claiming that PBMs drive up drug costs. However, the language to eliminate spread pricing in Medicaid and require more transparency from PBMs was knocked out of the Senate reconciliation bill after the parliamentarian said it would likely violate the strict rules against non-budgetary items. As Senator Charles B. Grassley, a member of the Finance Committee, put it, I think it's pretty clear that we ought to have a PBM bill before the end of the year. The package will include 3 PBM bills passed last year, but the question remains, will it be enough to make a significant difference in the lives of Americans struggling to afford healthcare? And this is where we want to hear from you. Do you think the proposed bipartisan health package will be effective in lowering healthcare costs? Or is it just a drop in the bucket? Share your thoughts in the comments below.